Anger issues could be a symptom of depression, especially if it started recently, meaning you didn't have it before growing up, but now you are finding it difficult to regulate your emotions. And so, anger issues is typically a symptom of what we call emotional dysregulation. And emotional dysregulation is a common symptom in many mental illnesses. So, the onset of anger issues is very important in leading the doctor to the right diagnosis. If the anger issues have been there since childhood, then you're looking at developmental disorders such as ADHD, autism, oppositional defiant disorders, intermittent explosive disorders, and many others. But if the anger issues perhaps started during adolescence and then continued into adulthood, then from the age of 18 you might be looking at personality issues, disorders such as borderline personality disorder, narcissistic personality disorder, antisocial personality disorders. They're typically mostly associated with anger issues. Now, coming back to anger issues related to depression, it would be of recent onset, meaning something may have happened in your life that has destabilized you, that has made it difficult for you to manage your emotions. It could be a prolonged stressful period, it could be something overwhelming at work, burnout, it could be something in relationships that you're dealing with that is now making you easily angry or putting you in an irritable mood. Now, in my experience, for the patients I've met, someone comes to complain of anger issues because it's the only bothersome symptom that they can notice. But they're not paying attention to the other symptoms that they might be struggling with of depression. So this person would be having symptoms of sleep disturbances. They're unable to either fall asleep, stay asleep, or they wake up too early. They've got issues with appetite, so sometimes they've got a big appetite, sometimes they don't have appetite at all. They're moving slower than usual, or they're fidgety. They've lost concentration. They're unable to pay attention for the periods that they used to pay attention. So if they were able to concentrate on something for 15 minutes straight, they're not able to do that anymore. They've lost interest and pleasure in things that they used to find interesting and pleasurable. So all of these symptoms that actually meet the diagnostic criteria of a depressive episode, they're not paying attention to because they don't consider them as bothersome as the anger outbursts. Because for them now, interacting with people becomes very difficult because they feel like that person is going to say something that's going to annoy them. Or even if they don't say anything, they still feel annoyed. They are in an irritable mood. They just feel irritated all the time. And so they might also have a symptom of social withdrawal. They're avoiding people now to see if maybe it can reduce their symptom of irritability, but then it doesn't. And so it's very important for you to get assessed thoroughly for your anger issues to understand what could be the accurate diagnosis for the problem that you're experiencing. If it's recent onset, especially in adults, and you're going through a difficult period, you're going through a chronically stressful environment, you're in a chronically stressful environment, you're burnt out, you're going through relationship issues, it might be a symptom of depression, and you should have it checked out by your psychiatrist to be carefully assessed to know what it is.